Good evening, Bahamas. You're tuned into MB12 Weekend, broadcasting from Cable 12 Studios on Robinson Road. Coming up tonight, the Bahamas Insurance Brokers Association says NHI won't stop cookouts. This as the opposition says it can get behind catastrophic NHI coverage. How the Salvation Army plans to make the holidays a little better for the needy. Kids gear up to cheer on junior Junkanoo participants. And as always, we check out this week's cutest kids and pets. I'm Paige McCartney. We've got those stories and more straight ahead on MB12 Weekend. Welcome once again to MB12. National Health Insurance in its current form will do little to stop cookouts and the financial difficulties Bahamians face in affording health care. That's according to Bahamas Insurance Brokers Association President Felicia Knowles, who is challenging the Christie administration's narrative that the implementation of the NHI scheme will stop the cookouts associated with health care fundraising efforts. She charged that comments by Prime Minister Perry Christie, Health Minister Dr. Perry Gomez, and their cohorts about poor black people dying because they cannot afford health insurance are sensationalism and do not address the facts.
There is no substance to what they're trying to produce, and then they're saying to the people, this is you're not going to no longer be black, poor, and you're no longer be able to do cookouts because this is what NHI is going to provide you. But then you're saying to the public, we're going to do enrollment for you to have primary care. Primary care does not remove the cookouts. Primary care does not resolve the chronic illness.
The BIBA president's comments are supported by the fact that NHI in its initial rollout will not cover catastrophic illnesses, nor will it resolve the chronic illnesses that plague the Bahamian population. On Wednesday, Deputy Chief Medical Officer Dr. DeLon Brennan said the first phase of government's NHI coverage, which is expected to begin in April 2016, will be a primary care package that would include annual physicals, health maintenance exams, and other outpatient care services for minor illnesses and injuries. A vital benefits package is planned to be rolled out after government analyzes the success of the first phase and will come at a cost to the Bahamian people in the form of a proposed tax increase, according to health officials. Knowles said the government is selling a dream when it talks about giving Bahamians access to great health care.
You sensationalize into the people that I'm giving you health care because I care about you. I care that you can have access to great medical care. But you're actually giving them registration for the first 3 months, and then you're giving them primary health care. What does primary health care is to an individual? That's a where you present to a doctor for blood work to find out if you're okay or if you're sick, and then you go to a specialist. What happens if you find out that, okay, I have diabetes, I need renal, I need dialysis, right? I have a heart condition, I need a surgery. I'm going to have to do a cookout because the NHI is only going to cover primary care services.
The BIBA president's comments are supported by the fact that NHI in its initial rollout will not cover catastrophic illnesses, nor will it resolve the chronic illnesses that plague the Bahamian population. On Wednesday, Deputy Chief Medical Officer Dr. DeLon Brennan said the first phase of government's NHI coverage, which is expected to begin in April 2016, will be a primary care package that would include annual physicals, health maintenance exams, and other outpatient care services for minor illnesses and injuries. A vital benefits package is planned to be rolled out after government analyzes the success of the first phase and will come at a cost to the Bahamian people in the form of a proposed tax increase, according to health officials. Knowles said the government is selling a dream when it talks about giving Bahamians access to great health care.
Insurance brokers and agents are not looking out for themselves. Our role is that we protect the policyholder. Okay? So if you're saying that we're looking out for ourselves, then we're looking out for the individuals who's anticipating this NHI or this access to great health care. All right, so you can't truly say that we're looking out for ourselves. So if we're gone, then the benefits and your advocacy is gone.
Knowles also took issue with the Sanidez International suggestion that insurance agents and brokers be done away with because that would mean wastage in the system. With close to 900 agents and with respect to brokers, 50 or so companies with staff anywhere from 5 to over 100, thousands of people could lose their jobs if the Sanidez proposal is carried out, according to Knowles. While former Free National Movement Senator Dr. Dwayne Sands says an FNM government would immediately include catastrophic coverage as a part of a universal health program. Sands said it is clear that the Christie administration's proposed plan for NHI, which will focus on primary care for at least the first year, is not what the PLP promised the Bahamian people. He said Bahamians were promised one thing, no more cookouts, and are now getting something entirely different. Sands was responding to Dr. Brennan, who said the first year of primary care services under NHI, scheduled to begin in April, will cost around $100 million. Primary care is a basic level of health care that includes programs directed at the promotion of health, early diagnosis of disease, and prevention of disease. Primary care services are a subset of the vital benefits package, Brennan explained. It does not include catastrophic illnesses such as cancer and heart disease. Brennan could not say when a full vital benefits package will be rolled out. Minister of Labor and National Insurance Shane Gibson has said that it will take 10 to 15 years to fully implement NHI. Sands said when a Free National Movement government is elected, the National Health Program will be dramatically altered to include catastrophic coverage immediately. The cardiothoracic surgeon added that chemotherapy can cost as much as $1 million per year and that cardiac surgery in the Bahamas subsidized can cost as much as $40,000 plus value-added tax, with a pacemaker costing between $7,000 and $10,000 plus VAT. Prime Minister Perry Christie said in October the government is considering introducing a tax to fund NHI in the next fiscal year. However, Christie stressed that the government does not intend to do anything to disrupt the economy. The FNM previously promised catastrophic health insurance during the 2012 general election campaign. And in news from the police tonight, officers are on the hunt for armed robbery and shooting suspects. Reports are that just after 1:30 yesterday afternoon, a woman had just pulled up to her Palmetto Drive Seabreeze home when two armed men robbed her of her gray Kia Sportage, license plate number 171424. Then shortly before 7 last evening, another gunman robbed a woman sitting in the parking lot of a business on JFK Drive of two cell phones and her black 2004 Nissan Skyline, license plate number 278409. And police say about an hour later, a man armed with a handgun robbed a woman in the front of her home on Swordfish Street in Stapleton Gardens of her purse and other personal items before speeding off in a black Honda. 3 more incidents were reported last night, according to police. Around 2 this morning, police say a woman was outside of a Poinciana Street business when a robber grabbed her handbag and personal items before running off. Another man was at a business on Nassau Street when the same thing happened to him. An armed man robbed him of cash before running off. And in the final incident, police say a group of men was standing in the parking lot of a business on Wolf Road at around 3 a.m. when 2 gunmen robbed them of cell phones and cash. One of the gunmen shot one of the victims before running off. That victim is in serious condition in hospital. Now, on a lighter note, officials at the Salvation Army are hoping to have a much better holiday season this year. In recent years, the major nonprofit organization has had to deal with dwindling donations. In this report, our Jasmine Brown takes a look at how officials plan to raise those much-needed funds over the next few weeks.
It's no secret that charities have suffered major blows when it comes to raising money, and with fewer people giving, they've had to come up with innovative ways to boost contributions.
Well, we're hoping that things will recover from last year, certainly. It's been a bit of a struggle for us during the last year because of a reduction in income, and we can only give according to as we receive, of course. We're hoping that people will be generous this Christmas season and we will be able to do as much as we had planned.
Why Last year, the Salvation Army reported that they were down by 30%. Their goal was to raise $160,000. Due to the shortfall, officials said they had to scale back on some of their programs. According to Major Clarence Ingram, they want to avoid that this year.
We will be doing our Christmas hamper program, Christmas parcels, where we give to the needy. Will probably be, maybe somewhere close to 1,000 of those.
Yeah.
And then there is the Christmas meals which we do for the seniors, which is another 700 or so people which we would provide a meal for. We would also be helping the children with toys, partnering with Rotary in particular for that one, is it?
Yeah, they
yes.
partner with us for that.
And there are quite a number of institutions which we will be visiting through our League of Mercy group and providing personal care items as well. So there are quite a few things which is happening during the next 2 to 3 weeks. So we are very busy putting everything together at this point.
Ingram says one of their biggest fundraising campaigns has always been the bell ringing promotion. The Salvation Army chief admits that giving always gets off to a slow start, but partnerships with local businesses and organizations have helped.
Early on in the campaign, of course, it takes a little while to get it up and running, but we've had good participation by our local clubs and committees to get it started, and as well some businesses have been helping out. So it's been going pretty well normal from previous years, shall we say.
Last year, the kettle campaign was thrust into the national spotlight for all the wrong reasons after one of the charitable organization's fundraising kettles was stolen from the front of a major shopping complex. It was the first such theft reported in the 84-year history of the Salvation Army in the Bahamas. Reporting for NB12, I'm Jasmine Brown.